First of all, this is a Christian school. You're going to get a Christian nursing education. Our goal is not just to make our students good nurses, but it's to make them good Christian nurses. And that's what Dordt College is all about. Typical nursing programs, you will go to a medical floor, and then you will go to obstetrics where they labor and delivery and mothers and babies. You'll go to a mental health unit and you go to different units. That's called a medical model of how things are done. And that isn't quite how nurses think. So as we were developing this program, we started looking at what's a good way to do this. So we came up with concept-based, which means we start with the concept. So your concept might be breathing, oxygenation. And so then we're going to think about, how do we assess for breathing? What do? Well, first of all, you look at patient's color. There's a million things you can do to assess breathing. And then how do you intervene? What are we going to do if somebody's struggling or not breathing? And then we're going to think about what's wrong with them. Because nurses don't diagnose. We don't start with the diagnosis. We don't start with pneumonia. We start with the patient and the symptom. And that's what nurses take care of. So it's just a different way of looking at nursing.
The nursing department here at Dordt, as we transition and grow, we're going to use lots of different methods. Not only do we get to experience theory with our students, we get to have them in the classroom, we get to look at the amazing creation of the human body, but we also get to do things in the skills lab, so they get to do lots of different hands-on things. We're also going to have a simulation labs where they get to practice more in a real-world experience, but yet in a very safe environment. So in simulation, you get to work together. You also have other people on the outside watching it who then can discuss it with you. We're all students together. It's very safe, it's all confidential, and I think it really brings the situation and brings how maybe even the patient felt. Sometimes one of the students may be the spouse or maybe a family member, and so then they can bring that perspective into, and so we all get to learn together from those different aspects, which is really exciting, and hopefully will better prepare them to go out then and work in the different facilities where they're called.
All our professors here work their hardest to get us to our fullest potential, to make sure that we're not falling behind. They have a set of standards that we want to follow, but they make sure that we're getting there. The biggest challenge, I'd say, for being a male nursing student is a big female-based profession, and that's what a lot of people think when they hear nursing. For my class, it's a little different because we have a couple of males with us, so that's definitely changing, and more males coming into the nursing profession is changing.
I would say the nursing program at Dordt is challenging, but you learn a lot, and they also really incorporate the Christian faith and how that applies to the career of nursing itself.